Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing how to treat an acute cough. In this video, we'll talk about non-pharmacologic treatments you can use to treat a cough, or things other than medication. We'll also talk about pharmacological therapy, or medications that can be used to treat a cough. We'll also go into a little bit about what causes a cough and what is a cough in general. Now, before I get into the information, just keep in mind that this video is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, having said that, let's jump right into it. So the first thing to discuss here is the pathophysiology. So a cough is a common symptom of many respiratory diseases and is a normal physiological response aimed at protecting the respiratory tract. It is a voluntarily induced or involuntarily activated reflex arc that can be triggered by a wide range of chemical or mechanical stimuli. Cough is present in many respiratory diseases and is classified as follows. An acute cough would be a cough lasting less than 3 weeks. A subacute cough would be lasting 3 to 8 weeks, and a chronic cough would be a cough lasting greater than 8 weeks. Some common causes of cough are asthma, COPD or chronic obstructive pulmonary disease, certain medications such as ACE inhibitors, beta blockers, ASA or NSAIDs in sensitive individuals, environmental and occupational irritants. It may be caused by a foreign body, or GERD, also known as gastroesophageal reflux disease. Heart failure and a pulmonary embolism may cause a cough, as well as rhinitis and sinusitis. If somebody is being treated for a cough, the goals of therapy would be to alleviate symptoms, diagnose and treat the underlying cause when possible, and to prevent complications. You should refer to a doctor if signs of choking on a foreign body, food, or vomit is present, if there is rapid breathing, shortness of breath, or wheezing, if a patient has chest pain, as well if a patient has blue lips, tongue, or face, feeling of suffocation, bloody or frothy pink sputum, breathing difficulty after smoke, flame, or fume inhalation, if they have night sweats, extreme fatigue, or drowsiness. They should also be referred to a physician if they have acute confusion or a recent change in mental status. If history suggests the cough may be due to a DVT or a PE, deep vein thrombosis, or pulmonary embolism, recent trauma, or surgery, they should also be referred. Prolonged or high fever is a reason to go to the physician, as well as a cough that has been present for greater than 3 weeks. Now for non-pharmacologic therapy. Although evidence is lacking, hydration with oral liquids and humidification of room air may be beneficial. Room humidifiers used as preventative measures should be well cleaned to avoid aerosolizing mold. Nasal saline irrigation can help alleviate symptoms related to nasal congestion in the context of acute upper airway infections. Avoid exposure to inhaled irritants such as smoke, dust, pollutants, and allergens. Now for pharmacologic therapy. So the treatment of underlying conditions is paramount. For example, in GERD or gastroesophageal reflux disease, treatment of the reflux itself can alleviate associated cough. Smokers presenting with cough are prime candidates for discussing smoking cessation strategies. A specific treatment is not always an option. For example, there is no cure for the viral infection that causes a common cold. Despite the lack of evidence to support their use, non-specific treatments such as non-prescription antitussives and expectorants are frequently used in these cases depending on the presence or absence of mucus or sputum. Alright, that's all we're going to talk about today with how to treat an acute cough. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.